One of the factors that determine the outcome of health and well-being is the social determinants of health. So social prescribing is something to help clients to fulfill their health and well-being goal in a holistic way. So it's essentially bridging the medical care and the social care.
Social prescribing here at Seaway Valley is really, instead of looking at what the problem is, it's really looking at what clients' strengths are. So really asking the question around what matters to you versus what's the matter. Another referral, and it looks like we have different walking programs. We have a snowshoeing program that operates in the winter. We have exercise classes for older adults.
My daughter suggested I come to one of the courses that they were giving was on COPD and asthma because that's what I have. I ended up meeting new friends and everything, and I've joined more classes, and I find it's very rewarding. All the courses that I've taken have changed my life quite a bit, like how to control it whenever there's stress in my life or pain, chronic pain. I've also learned healthy eating, which is great because I've lost over 100 pounds in 4 years. The staff here is great. You can be yourself and have fun, and they don't judge you.
So what kind of things do you think that we can offer in the community for food insecurity?
Link them to our community garden if they want to come in, and there's always free pickings for anyone in need.
Why did I volunteer? Well, it's sort of all because of the Heart Institute. I went for stents and triple bypass and that, and every time I went, there was the cardiac rehab center. So I said, well, maybe I could volunteer. I love to drive people around, and especially some of the seniors. I know I'm a senior, but some of the seniors, they can't go out much. A lot of the people feel a lot better after they leave, and they're able to talk to different people, get different insights, and not feel alone.
I'm seeing a huge impact of social prescribing in my clients. Their need to access care, especially in a ER setting or in a hospital setting, is much reduced because their needs are addressed, not just their physical health needs, but their social needs are met as well. It goes to show how holistic care can sort of improve outcome, not just for the patient, but for the healthcare system as well.
There's so much value in having social prescribing and a funded position to help advance this work, because if you're a solo physician or nurse practitioner in an office and you're trying to do this work, it can be really difficult without a team around you.
Collaboration and good teamwork is very important to implement the plan. Social prescribing should be incorporated in day-to-day clinical practice.
Of course, we want to address the issues in front of us around, what's physically wrong with someone, but I think it really is looking at what matters to them. Because we know, and the evidence is there, and the research demonstrates someone having self-worth, feeling connected, that sense of belonging. There's just so much value to that.
I praise this place like crazy. I'd suggest anybody come to this place, they'll help you.
This is what Seaway Valley Community Health Center has to offer. This program will help you. That program will help you. Try it out.